Has someone you love been changing in ways that seem small but still leave you with a feeling you can't quite shake? Maybe they've grown quieter, more forgetful, or just don't seem as strong as they used to be. Many people assume that when the elderly pass away, it happens suddenly. But the truth is, the body often sends quiet warnings, sometimes for months, even a whole year before the final stage of life arrives. The real problem? These signs are easy to miss. They start off subtle, things you can brush off as just aging. And by the time you realize what they really meant, it's too late to prepare, too late to make those last moments count. In this video, we're going to talk about 5 key signs that can appear up to a year before an elderly person passes away. Some might be things you've noticed but dismissed. Others might seem minor, but they actually reveal the body's gradual decline. Recognizing these signs early isn't about fear, it's about being prepared. It's about making sure your loved one gets the best care, that you create memories you won't regret missing, and most importantly, that their final stage of life is filled with dignity, comfort, and peace. Stay with us until the end because understanding these 5 signs can help you prepare both emotionally and practically. When you know what's happening, you won't be caught off guard. You'll have the chance to make every moment count. Now, let's get started. Sign number 1, significant weight loss. One of the first and most telling signs that a person may be in their final year of life is unintentional weight loss. At first, it might not seem like much, a belt that suddenly needs another hole, shirts fitting looser, or a once hearty eater who now barely finishes half a plate. Families often dismiss this as part of aging, but losing weight without trying is rarely a good sign. It usually means the body isn't absorbing nutrients properly anymore. Muscles are shrinking and essential systems are slowing down. Aging naturally leads to some loss of muscle, but when it happens too fast, it's a red flag. The body might be struggling to digest food, or it may no longer be processing protein efficiently, leading to muscle wasting. Uh, this loss of strength doesn't just make movement harder, it increases the risk of falls, weakens the immune system, and makes the person more vulnerable to infections. Another reason for weight loss, a fading appetite. Many elderly individuals lose their sense of taste, making food less enjoyable. They may start skipping meals or eating much smaller portions, but this isn't just about personal preference, it's a physiological shift. The body, in a way, knows that it's beginning to shut down. This is just the first sign, but there are 4 more you need to know, some of which might surprise you. Stay with us because recognizing these changes could make all the difference in how you spend the time that remains. Long before dramatic symptoms appear, the body starts making quiet adjustments. One of the biggest? It stops signaling hunger as often. When the brain no longer tells the body to seek food, energy levels drop, muscles weaken, and overall health gradually declines. But weight loss isn't just about eating less, it can also be a warning sign of underlying conditions. Chronic illnesses like cancer, heart failure, or kidney disease often cause unexplained weight loss long before other noticeable symptoms appear. Even depression or cognitive decline can reduce appetite, creating a downward spiral where the body isn't getting the fuel it needs to function. Families often try to fix this by encouraging their loved ones to eat more, offering favorite meals, or adding protein shakes to their diet. But if the weight keeps dropping despite these efforts, it's important to understand that the issue isn't just about food. It's about the body preparing for a deeper transition. At this stage, forcing large meals may not help. Instead, focusing on comfort, offering easy to eat foods, and keeping them hydrated can make a far greater difference in maintaining quality of life. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about appearance. It's the body sending a message. Understanding that message now can help you prepare for the road ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Sign number 2, extreme fatigue and weakness. One of the most striking changes in the final year of life is an overwhelming, persistent fatigue that doesn't improve with rest. This isn't just feeling a little worn out after a busy day, it's a deep exhaustion that makes even simple tasks feel nearly impossible. Getting out of bed becomes a struggle. Walking across the room feels like a marathon. Even holding a conversation can drain every ounce of energy. This isn't just normal aging. Um, it's the body conserving its last reserves of strength. As organ function slows, the body prioritizes what's essential. The heart doesn't pump as efficiently, circulation weakens, and muscles no longer receive the same amount of oxygen. That's why elderly individuals in their final months often feel weak, unsteady, and unable to maintain the same level of activity they once enjoyed. Another key factor is the body's metabolic slowdown. Normally, the body produces and uses energy to fuel movement and daily functions. But as life nears its final stage, that energy is redirected, preserved rather than spent. This shift is part of the body's natural process of letting go. If you've noticed a loved one experiencing extreme fatigue, sleeping more, struggling to move around, or simply lacking the energy for things they once loved, it may be a sign that their body is preparing for a major transition. And understanding this now can help you provide the support, patience, and love they need in this phase of life. As the body slows down, so does the mind. One of the earliest and most telling changes is an increasing need for sleep. Your loved one may start sleeping more, needing longer naps during the day, and finding it harder to stay awake for extended periods. Some may even experience sudden drops in energy. One moment they seem fine, and the next they're completely drained. This is because the body is redirecting energy toward essential functions, prioritizing preservation over activity. But perhaps the most heartbreaking part of this process is the emotional impact of fatigue. Many seniors who once took pride in their independence start feeling frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or lose interest in hobbies, not because they don't care, but because they simply don't have the energy. This can create a painful cycle of isolation where they stop trying altogether, which only speeds up their decline. For families, watching a once active loved one become exhausted and withdrawn can be difficult to accept. It's easy to assume they're just being lazy or that they need to push through it, but the reality is that forcing activity won't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice deep, ongoing fatigue that isn't relieved by rest, take it as a sign that the body is going through a major transition. This is the time to cherish conversations, create moments of peace, and support them without expectations. Because in the end, it's not about how much they can do, it's about making sure they feel loved, understood, and at ease. If you're still watching and finding these insights valuable, comment number 2 below to let me know you're here. And if you haven't subscribed yet, make sure to hit that button and turn on notifications so you don't miss any future videos. Your support helps us continue creating content that informs and inspires. Sign number 3, increased cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most noticeable and often unsettling changes is in how they think, communicate, and interact with others. Someone who was once sharp and engaged may start forgetting things more often. struggling to follow conversations, or seeming disoriented in familiar places. They might repeat themselves, forget names, or lose track of time, even if they've never had memory issues before. These cognitive changes can appear months, sometimes even a full year before death. But this isn't just ordinary forgetfulness. The brain, like every other organ, depends on a steady supply of oxygen and nutrients to function properly. As circulation weakens and the body's energy is redirected toward core survival functions, mental clarity begins to fade. As the brain receives less oxygen, its ability to function starts to decline. A person who was once quick witted and decisive may suddenly struggle to make simple choices. They might forget familiar faces or places, become easily confused, or even have moments of clarity followed by sudden disorientation, almost as if their mind is fading in and out. This unpredictability can be unsettling, but it's one of the body's ways of slowing down. Another common sign is emotional withdrawal. Someone nearing the end of life often loses interest in social interactions. You might notice them speaking less, engaging less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones, it's that their brain no longer processes emotions and engagement the same way. Conversations become exhausting, loud environments feel overwhelming, and eventually many seniors retreat into their own world. Mood and behavior can also shift in unexpected ways. Some individuals become more irritable, anxious, or easily frustrated.
While others grow unusually calm and indifferent to things that once mattered to them. This isn't just a personality change, it's the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and reactions to situations may no longer match what they once were. For family members, the stage can be one of the hardest to navigate. Watching a loved one become confused or emotionally distant can feel like losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to pull them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and simply be present. Even if they don't always respond, they can still feel your love and presence. If your loved one is becoming more forgetful, confused, or withdrawn, don't ignore it. These are often early signs that the mind and body are preparing for the final transition. This is the time to be patient, cherish quiet moments, and create a familiar, peaceful environment. Because even when words fade, love and comfort remain. Sign number 4, frequent infections and slow healing. As the body begins to wind down, one of the clearest physical signs is a weakened immune system. Someone who rarely got sick before may suddenly seem to catch every cold, every flu, every small infection that's going around. What used to be minor illnesses now take much longer to recover from. And even simple wounds, like a small cut or bruise, seem to take forever to heal. These changes aren't random. They're clear signals that, as the body weakens, it loses its ability to defend and repair itself the way it once did. One of the biggest concerns in the final stage of life is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system struggles to fight back. Many families assume these are just isolated illnesses, but when they start happening frequently or take longer to clear up, it's often a sign that the body is losing its resilience. Even antibiotics, which once worked quickly, may seem less effective. The person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because, as circulation slows and organ function declines, the body simply doesn't respond to treatment as well as before. Another often overlooked issue is chronic wounds. If you notice that small scratches, sores, or bruises aren't healing properly or keep reopening, it could mean that circulation is compromised. Poor blood flow prevents oxygen and nutrients from reaching the skin and tissues efficiently, slowing healing. This is especially concerning for those who are less mobile, as pressure sores can develop and lead to dangerous infections if not carefully managed. What's even more alarming is that infections in the final year of life often don't look the way we expect. Instead of a high fever, an elderly person may simply seem more tired than usual, more confused, or less interested in eating. In fact, a sudden decline in mental alertness is often the first warning sign of an infection, long before other symptoms appear. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or another hospital stay will fix the problem. But at a certain point, the focus often shifts from curing to comforting, making sure they stay hydrated, keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medication that may only prolong suffering. If you're still watching and finding these insights valuable, comment number 4 below to let me know you're here. And if you haven't subscribed yet, hit that button and turn on notifications so you don't miss future videos. Your support helps us continue creating content that informs and inspires. Sign number 5, a shift in breathing patterns. As the body nears its final stage, one of the most noticeable physical changes is how a person breathes. Watching a loved one experience major changes in breathing or circulation can be one of the most unsettling signs that the body is entering its final stage. One of the most telling indicators is irregular breathing patterns. You may notice that your loved one breathes more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become erratic, speeding up and then suddenly slowing down. Some individuals experience a distinct rhythmic breathing pattern called Cheney-Stokes respiration, where deep, rapid breaths alternate with long pauses. These changes may start subtly, but often become more pronounced and frequent as the body weakens. Another major sign is weakened circulation. Their hands, feet, nose, or ears may start to feel cold to the touch, and their skin may appear pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. It's a clear indication that the heart is no longer pumping as strongly as before. Shortness of breath can also become more frequent, even with minimal movement. Simply sitting up, speaking, or shifting positions might leave them winded. They may begin breathing through their mouth more often, or need to stop mid-sentence to catch their breath. If they once walked across the room effortlessly, but now struggle to do so, it may be a sign that their lung function is declining. In some cases, fluid buildup in the lungs can make breathing even more difficult. This may cause a persistent cough, gurgling sounds, or a sensation of chest tightness. Many people assume it's just congestion from a cold, but in elderly individuals, nearing the end of life, it often signals that the lungs are weakening. This discomfort can make lying flat unbearable, so they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths or to panic that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not be a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease their discomfort. At this stage, the focus shifts from trying to fix things to simply providing comfort. Holding their hand, speaking softly, and making sure they are at peace matters more than anything else. These final moments are a time to be present, to reassure them, and to surround them with love. If you're still watching this video and found these insights valuable, comment number 5 below. And if you haven't already, subscribe and turn on notifications so you don't miss future videos. Your support helps us continue to create meaningful content that informs and inspires. Now that you know these 5 key signs, you can recognize them early and ensure your loved one's final stage of life is filled with comfort, dignity, and love. In some cases, medications or oxygen therapy can provide relief, but at this stage, the focus shifts from trying to fix the issue to simply ensuring comfort. If you notice changes in breathing, cold hands and feet, or a bluish tint to the skin, take it as a sign that the body is conserving energy and that circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where your loved one feels safe and at ease. As we reach the end of this video, take a moment to reflect on what we've discussed: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear within the year leading up to an elderly person's passing. They may not all happen at once, and they may not always be obvious at first. But when you start noticing them, it's a clear indication that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the most compassionate thing we can do is listen to what their body is telling us. Instead of focusing on reversing the inevitable, we can shift our attention to making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death. It's about being prepared for it. Recognizing these changes early allows you to offer better care, make important decisions ahead of time, and ensure your loved one's final months are filled with dignity and love. This is the time to cherish every moment, share stories, and remind them they are valued and never alone. If you're noticing these signs in someone close to you, take a deep breath. You are not alone in this journey. Many families have walked this path before, and while it is never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned from this video and how you plan to use it in your life. Your thoughts are important to us, and reading your comments gives us motivation and encouragement. If you found this video helpful, please like, subscribe, and share. Your support helps us continue creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.